Okay, so we'll be starting with part 5 of anesthesia. So, in this part, we will be talking about monitoring during anesthesia. So, monitoring during anesthesia. So, here we have neuromuscular monitoring and we have muscle relaxation monitoring. So, now first coming to neuromuscular monitoring, here we will have train of four frequencies which will be used for monitoring. So we have no drug effect, we have non depolarizing block and depolarizing block, in which we have phase 1 and phase 2 as well. Now with no drug we'll be having train of 4 like this. Ratio will be 1 here. In non depolarizing we will have fade, which means it will keep on decreasing like this. So ratio will be 0.4 here. Then in phase 1 and phase 2, first we have constant, but it is diminished or decreased, like only short lines will be seen. And here ratio is again 1. And in phase 2 we have fade again. So we'll have ratio as 0.4 here now. So after, if it is greater than 5 mg per kg, then it will again enter into non-depolarizing block and we'll see fade. So this is how neuromuscular monitoring will be done. Now coming to few facts here, we have most common nerve used in this will be ulnar nerve, and second most common will be facial nerve. So in ulnar nerve we'll see adductor pollicis contraction, and in facial we'll see action of orbicularis oculi. Now 2 hertz frequency difference is maintained. Tetanus is seen at 50 hertz. And when you have to do extubation, so whenever it is greater than, ratio is greater than 0.9, it means respiratory muscles are recovered, then patient is ready to be extubated. So you will also have head lift test, in which patient is asked to hold their head by lifting it up for 5 seconds at least. So this is how you will be doing this monitoring. Next we'll see other modes of monitoring as well. Now coming to next mode, that is bispectral index. So in bispectral index we will be measuring the depth of anesthesia and level of consciousness will be measured here. So this is basically a frontal processed EEG, and you will have 0, 40 to 60, then 100. So 0 means patient is in coma and 100 means patient is fully awake, and 40 to 60 means patient is under anesthesia. So this is how you will be having the scale. Now coming to next one, that is pulse oximetry. So pulse oximetry will measure hemoglobin saturation that is present. So there can be false high sometimes there can be false low. So high will be seen in carbon monoxide and hemoglobin concentration, like it will be around 100%, and low will be seen in case of methemoglobin, where SATs will drop up to 85%, which is actually false low percentage. So we have to use carbon monoxide oximetry in order to know this SATs accurately. And pulse oximetry works on the principle of Beer-Lambert's law. It works on basis of Beer-Lambert's law. So oxyhemoglobin and deoxyhemoglobin. Oxy will be seen as infrared light and deoxy will be seen as red light. So this is how you will be seeing monitoring anesthesia by different devices. Now we'll be talking about oxygen delivery devices and what are their max flow rate and max saturation capacities. Now starting with oxygen delivery devices. So just remember these devices in the same order so it will be helpful for you. So starting with nasal cannula or nasal prongs, then we have Hudson's mask, then we have Venturi masks, then we have non-rebreathing mask, then we will have high frequency nasal cannula, high flow, and we'll be having CPAP or non-invasive ventilation. So these are the types of oxygen delivery devices. Now starting with their max flow rate and their max saturation rate. So you will have to remember it like this: 5, 10, then you will have same numbers 15, 15, then infinity, and coming to this it is 60. Now here we'll be starting with 100, 100, then we'll have 60, 60, and in between we have 85 to 90%, and here we have 40. So 40 basically and 60 and this one. So these are the things you have to remember in specific. Now Venturi, HFNC and CPAP, all these are called as high flow devices that are there. Now coming to more details. So CPAP, what are the requirements of CPAP? So patient has to be conscious and patient must have empty stomach in order to undergo this. So conscious patient and empty stomach. Then high flow nasal cannula, it basically decreases nasopharyngeal dead space. So there will be humidification and B positive and may delay intubation time. So these are the benefits with this. And coming to Venturi mask, so we have some color coded things here. So coming to Venturi masks, so beware of your ruled GF. So this is how you can remember: blue, white, then orange, yellow, red and green. So here just remember the percentile, like roughly this will be 24%, 28, 31, 35, 40 and then 60 directly. So it will be increasing, not in like it is an increasing order. Now what are benefits of Venturi mask? So they can be used in oxygen toxicity or they can prevent this, and you can also use this for fixed oxygen delivery, and it is used in COPD obviously. So this is about oxygen delivery devices we have discussed, and in next part we'll be talking about Maples and circuits, and we'll be starting with anesthesia workstation as well. Thank you.